Hello there, David Fitzgerald, Dublin Physiotherapy Clinic here again. Today I'd like to give you some information on how to manage chronic foot pain, particularly when many treatment options have failed. So the kind of conditions we're talking about here are people with chronic plantar fasciitis, people with arthritic change in the joints of the bridge of the foot and the midfoot joints, people with chronic toe pain, whether that's a bunion, what's called a hallux valgus, or a hallux rigidus, which is a stiff big toe. So they're the typical kind of caseload that we see, perhaps arthritic change in the ankle joint, or a chronic Achilles tendinosis too. So there's a number of different conditions that ultimately end up in limiting your ability to walk and take weight through the legs. So if conservative treatments measures have failed, such as physiotherapy, stretching, strengthening, using inserts into shoes, which may initially be something simple like a cushioned insole, or that may have progressed to a more customized orthotic, which is a specifically designed device to control your foot mechanics. So when those things have been tried and haven't been successful, there are some other medical interventions that can be tried. Cortisone injections can be used in joints where there's persistent joint pain, but that's really just an anti-inflammatory measure. So usually in the weight-bearing joints, usually the period of relief can be pretty limited, particularly if there's arthritic change in the joints. So it can give palliative relief, but there's a practical limit to how much steroid injection can be given into joints, and usually 2, maybe 3 a year would be the maximum that can be considered. The general principle now in terms of injecting other tissues, the softer tissues like the Achilles tendon or the plantar fasciitis, is that the general trend now is not to do it because there is a risk of rupture of those tissues. And it's just a response to the steroid injection. So although the injection can reduce the inflammatory response in the proportion of people, it causes the target tissue to destruct, and obviously that's not a good therapeutic outcome. So the general trend now is not to inject in the soft tissues around the foot, particularly in the weight-bearing ones. The other surgical procedures for sore joints in the middle of the foot are basically fusions. So that's a pretty radical operation. So there's metal work put in and motion is eliminated from the joints. So that's a pretty radical procedure, and one would need to give very careful consideration as to what the benefits of that procedure would be in terms of both pain and in terms of your functional improvements in functional capacity. The procedure for the bunion, for correcting a bunion, is now a very useful procedure. The older procedures, which 30 years ago when I started in physiotherapy, were pretty rudimentary. But now when somebody has a bunion where the toe is just drifted off to the side, they can do a reconstruction operation, which involves taking a wedge of bone out, putting some plates in to reorientate, and tightening up the tissues that have become stretched and deformed. So it is proper reconstructive surgery, but the recovery time from that can be typically anything from 4 to 6 months. So it can be a slow procedure. And more recent times, for people who have a degenerate big toe, and we've talked about that in the past, people could trivialize a degenerate big toe, but it can be damn sore to walk on. Joint replacement is an option there. And also I've recently seen some cases where there's been a ball inserted into the joint to actually mimic the joint, and that seems to be functioning very well for this particular case a couple of years down the track. But if all those options have been exhausted and people have limited capacity to walk or weight bear or do their chosen activity, there are some footwear considerations that are worth looking at. One of the first modified shoe styles to be available on a widespread commercial basis was a brand called MBT, and the basic premise of the MBT was that they produced a curved undersole on the surface of the shoe, so that the central part of the shoe was a curved surface. And the principle there was that instead of the normal foot pattern whereby the heel strikes the ground first, then we rock over onto the middle of the foot and then pivot off the front of the foot. The principle of this shoe design is that you rock around the middle of your foot, so it takes the pressure of heel strike away, and it doesn't require you to pivot off the front of your foot. So if those regions are painful structures, it's obviously a way of trying to work around that. MBT don't seem to be as freely available now, certainly in this jurisdiction, possibly still available online, but I don't see so many of them available. There are some copy designs of those, but there's also a running shoe brand called HOKA, HOKA, which are designed with a similar kind of principle. And up until recent times, they were generally a running or an outdoor pursuits kind of a shoe. But I've seen people recently who've got a more formal style of shoe, which would be suitable for a work environment if it's not appropriate to wear training shoes. So HOKA is another brand that offer an option for trying to really just change your walking mechanics completely. So using a different style of weight bearing through the foot to try to take pressure off. There's also another high-end shoe brand called Mephisto. It's a Portuguese brand, and they do a high-end shoe which also has this kind of a curved insole, particularly for walking, but a wide variety of options there. I should state at this point that I have no commercial interest in any of these brands. I'm just purely relaying this information because we've seen people in clinic who have derived some benefit from them. So if you do happen to suffer from foot pain, I thought it was worth sharing that information with you. But there's no commercial interest from my perspective. And as you know, we've talked about that before in healthcare. That's one of my bugbears. I do feel there needs to be more transparency about that. So I hope that was some useful information for you. It's basically a way of just trying to optimize as much as you can in terms of your capacity to weight bear, and it's another component to consider if you like being active and up on your feet. So hope you enjoyed that. I'll see you again on another video. Bye for now.